World Health Organization South Africa, and supported by the National Department of Health. Building on the success of the landmark 2023 Diabetes Summit, which united over 500 participants and produced the influential Diabetes Summit report, this year takes the next step, turning discussion into action. This year's summit focuses on 5 strategic areas: awareness and prevention, education, management and access to care, surveillance, and innovation and research. Our audience brings together policymakers, healthcare providers, people living with diabetes, advocates, and innovators, all united by one mission: driving measurable progress in diabetes prevention and care. Thank you for being part of the movement toward a healthier South Africa. Let's get started. Welcome to the 2025 Diabetes Summit Information Session, hosted by the Diabetes Alliance in collaboration with the University of Pretoria and the World Health Organization South Africa, and supported by the National Department of Health. Building on the success of the landmark 2023 Diabetes Summit, which united over 500 participants and produced the influential Diabetes Summit report, this year takes the next step, turning discussion into action. This year's summit focuses on 5 strategic areas: awareness and prevention, education, management and access to care, surveillance, and innovation and research. Our audience brings together policymakers, healthcare providers, people living with diabetes, advocates, and innovators, all united by one mission: driving measurable progress in diabetes prevention and care. Thank you for being part of the movement toward a healthier South Africa. Let's get started. Welcome to the 2025 Diabetes Summit Information Session.
Colleagues, good evening and welcome to the Clinical Care Platform. I can tell you, sometimes technology wants to show you who's the boss, and I'm happy that we've managed to sort that out. Just to say welcome, colleagues. Are you well? How is the weather on your side? Why I'm at here, Joburg, we have beautiful rain, and we can never say no to rain. Rain is very important. It is one of those things that if you don't respect, you will dearly miss it. So yeah, we remain very thankful for such a blessing. How is the weather on your side? Update us there. Let me just check quickly. A few people. Paulina Mohashwa says hi, everyone. Nomonde, as always, welcome. Hanan, Ahmed, I know you don't miss any of our events. Mashole there. Dr. Kolisiwe, welcome, colleagues. Yeah, so today I'm not alone. I am with Dr. Patrick Ngasa Piotie. Dokotela, are you able to hear me? There.
Yes, I can hear you. Good afternoon, good evening to the colleagues.
I was actually, technology. I was actually saying, welcome, Doc, my public health colleague, who is an advocate. I can tell you that much. This is not the first time we host you here at the platform. Usually, we host you to give us, some empowerment and knowledge around diabetes care. But today, Dr. Ngasa is here, colleagues, as an advocate. He's got a very big speaker. If you can imagine someone holding a big thing, it's like diabetes, let's get to zero. That's what he's all about. Yeah, so it's a short event, colleagues. It's an information session we want to share with you on this awesome upcoming event, the Diabetes Summit 2025. And just oh, yeah, you know what? Today, my technology shame, it doesn't like me that much, but I'm hoping now you can hear me. Are you able to hear me, Brother Ngasa? Everything was muted. Now, are you able to hear me?
Yes, we can hear
Oh,
you.
awesome. Yes, I wanted to just, I won't read the whole thing, but I want you to focus on firstly the fact that he is a medical practitioner. He's got a master's in public health, a PhD in public health, but all those things don't mean nothing. The one that matters the most is his commitment to providing support and solutions for these non-communicable diseases, particularly diabetes. And you can see that he's got the very important strategic achievements in strategic leadership, policy impact, grantsmanship. That means he can secure funding for us, capacity building, and global advocacy. But I just want to read his leadership statement. He says, as a visionary leader in global health, Dr. Ngasa is a committed person in driving impactful solutions to address non-communicable diseases, particularly diabetes. He is motivated by a resolute dedication to averting millions of premature deaths that happen in the African continent. He is a champion for innovative solutions. He pursues impactful advocacy, but also strategic collaborations. And here we are talking about that collaboration between the Diabetic Alliance and also us as the clinical care platform. His focus remains in advancing research, in influencing equitable policies. Not easy, because there's too many priorities, but how do you ensure that there's awesome investment, particularly in public health? And Dr. Ngasa aims to reshape the global health landscape for lasting change using this important condition, diabetes. So I'm not going to waste a lot of time except to say welcome to you, colleagues. And let's give Dr. Ngasa a lot of hugs and thumbs ups, whatever you can do there, because when people commit their lives to helping us with a condition that half of us are probably going to experience at some point, we have to be very grateful. Brother Ngasa, welcome. Can I hand over to you to then take us through what we can expect at the summit 2025? Yes.
Well, thank you very much for the generous introduction. As introduced, I'm Patrick Ngasa Piotier. I'm based in Pretoria. I'm affiliated with the university, and I'm also leading the Diabetes Alliance. Just as a bit of a background to the colleague, the Diabetes Alliance is an organization that was created in 2020 to advocate for the rights to support people with diabetes in South Africa. In 2021, we realized that there were no really a national platform or any platform in South Africa where we were talking diabetes. And you can imagine by then we had COVID, the pandemic, and we also how people with diabetes were highly affected by the COVID-19 pandemic. So we started with a 4-hour event. It was an online event that we did at the time in 2021. We discussed at the time, we knew the buzzwords was building back better. Everybody was talking about building back better in those days. And then, yeah, we had a meeting. The deputy minister gave some closing remarks. WHO was involved, Department of Health, and some of the other players were there. After that, I became chairperson and I decided to have the first time in-person event, which happened in 2023. The team was translating policy into action because of the fact that at the time the Department of Health had just released the National Strategic Plan for the Prevention and Control of Non-Communicable Diseases. And for some of you might be aware, there's for the first time targets for diabetes and hypertension following the model of the HIV, but in diabetes and hypertension, we call them the 90, 60, 50 targets, where the mission is to find 90% or to diagnose 90% of people above 18 years who could be living with either hypertension or diabetes. 60% talked of obvious linkage to care, ensuring that they receive an intervention. The policy doesn't say what the intervention is, and 50% achievement of control. At the moment, it estimated that about 50% of those living with diabetes are unknown, And in general, when we do audits, we realize that is about 20% who are controlled. So you can imagine the gaps that is ahead of us in terms of diabetes. So that was in 2023. We did a report. We handed over to the Department of Health. This time around, we are growing from 1 day to 3 days. And on top of the usual events that I will share with you guys on the presentation, we are innovating this time around. The Diabetes Alliance, as Dr. Mawela indicated, we want really to create synergies among various organizations and partners to address this challenge of diabetes. The 2023 Diabetes Summit highlighted capacity building issues with the healthcare providers. So we say, instead of criticizing, why not do we provide some sort of training for the healthcare providers who are interested in perfecting their skills when it comes to diabetes? So that's what we did, and we have a number of partners who have come on board to assist us in curating a number of exciting workshops that we want to present with you this evening. So yeah, that's the background, the theme of the year, and I will share my screen right away. So the theme of the year is Innovate for Impact, Transforming the Future of Diabetes in South Africa. For those of you who are in the space, you can imagine over the years, there's been a lot of innovations in the diabetes space in terms of new products, in terms of tools. You talk about continuous glucose monitoring. You talk about actually also new ways of doing things. But when you observe the public sector, where 85% of our people are accessing care, you don't see some of those innovations reaching them. So there's a big challenge in terms of access. Some might talk about the issue of cost. Some might be saying it's logistics or whatever else. Nonetheless, as the Diabetes Alliance, we say it's unacceptable that the majority of people in the country are not benefiting from those innovations that are really changing the lives of people living with diabetes in everywhere else in the world. So we know, for example, from the HIV fight, that some of the advances in HIV, even to date, now we are talking about introduction, and Dr. Mawela will correct me if I'm saying something wrong, the prevention where there's this injection, I think, where you get to inject twice a year to be protected of HIV. And you can see it just came out and it's already available and being tested in South Africa. So there's this thing whereby there are new drugs in HIV space, they will be almost immediately available in SA. But when it comes to diabetes, we don't see the same movement. That's why we say, let's innovate for impact in order to really transform the future of diabetes in South Africa and meet those targets that the Department of Health have put for us in the NSP. So in terms of the dates, you can see from the 11th of November, that's in about 10, 11 days, 12 days from now, from to the 13th at the Radisson OR Tambo. It's in an area called Bredel, not too far from the airport, but it's not at the airport itself. You can see we have partners from the University of Pretoria, but other universities are also coming on board. The South African Medical Research Council, WHO, and then locally, obviously, Gauteng and Department of Health. As I said, it's a 3-day event. We have curated therefore a number of workshops. On day one, we'll just do an overview, and maybe for the interest of the audience, we can zoom into some of those workshops that are most of interest to the colleagues who are healthcare providers. As you can see, we have a color-coded index here, where the yellow, or what is looks like yellow to me, it's for healthcare provider, what we describe as the healthcare provider track. The blue, light blue, is for the live experience track, ensuring that we empower also people living with diabetes with skills that they can use back in their communities to also drive change at the level. And there is the light green, which is the mixed audience track. You will see mostly policy, advocacy, or otherwise type of workshops. On day one, we have a full day training for doctors and nurses on comprehensive diabetes management. I will take you guys through quickly the agenda, and it's quite rich. And you'll see that some of the things that we are bringing in are not usually done even in other diabetes management training. So it's really of high interest. Then we have for people with diabetes a workshop on peer support. You can imagine how it's important for people with chronic condition, the support that they can give to each other. So what we are ensuring here is that those who will be accessing this training will be able to receive in terms of tools and skills for meaningful connection in the various groups. We are doing it with the South African Depression and Anxiety Group. They are established in the space of peer support, although not in diabetes too much, but the skills that they have perfected over the years will now be made to at the disposal of people with diabetes. In the afternoon, we have a workshop on advocacy. You can imagine one of the things that we lament in the diabetes space is that the advocacy movement is not as strong as the HIV activism. Actually, for HIV, people like to call it activism rather than advocacy. But we are saying let's equip the people with diabetes so that they can also drive the movement and drive change themselves. We have HeLA, the Healthy Living Alliance, also very strong organization that has done great work with what we call as the sugar tax or health promotion levy. So they are bringing their skills to empower people living with diabetes. We also have curated a workshop to talk about diabetes in the workplace. The story here is because internationally, the World Diabetes Day theme is diabetes in the workplace. So we wanted to align ourselves to that. But also, from what we are observing on the ground, people with diabetes are facing various challenges in the various workplaces. And Dr. Mawela, you might remember when we were in Harstenburg the other time, where we heard the story about that miner, somebody who works at the mine, who is not accepting to go on insulin because he doesn't want to stop going underground. If he stops going underground, it will have a big impact on his income. Therefore, he prefers to stay poorly controlled on tablets as long as he can go underground. So we say these kind of policies, for example, should be questioned. So that's why we have this workshop, followed by another one talking about building a registry. I won't make a long story out of this, but one big gap in diabetes in South Africa is the lack of data. So we are thinking, why not, as the Diabetes Alliance, leading an effort to build a type 1 diabetes registry similar to what has been done by other organizations that will be there to share their experience, and we can learn from it as we venture in this initiative to build a type 1 diabetes registry in South Africa. Day 2 is when we have the actual opening ceremony. We can confirm that the Deputy Minister will be present, as well as the MEC in Gauteng, to give obviously your usual welcome and opening remark. The keynote will be delivered by the Deputy Minister. And after the opening ceremony, or towards the end of the opening ceremony, we have a guest address by Professor Ntobeko Ntusi, the President and CEO of the South African Medical Research Council. He is a cardiologist by profession and a researcher, and is really very close. NCDs are something very dear to his heart. Is really engracing us with his presence to share some words about why innovation matters for diabetes in South Africa. Then we will start with what we describe at the Diabetes Alliance as thematic sessions. You can imagine diabetes is complex and multifaceted. What we've done then, we've broken it down in various specific thematics. For example, awareness and prevention, education, access and management, and then you have surveillance and also research. So on the day one, we're gonna then cover awareness and prevention and education. These are 1 hour session where you have a moderator who is a person living with diabetes. You have a designated expert that makes a presentation to set the scene. And after that, it's followed by a 40-minute panel discussion. You'll see the panelists are really coming from various sectors, and those will ensure rich engagement. We then have in the afternoon an innovation showcase, the theme of the year being innovation. What we will do in that 2 hour slot is to give the opportunity to 8 innovators to present the innovation they've been working on, obviously related to diabetes. What is the challenge they were confronted with? What is the solution or intervention they implemented? What has been the impact, and what is the potential for scaling up? There will be an adjudicator panel to kind of give them some feedback and score the presentation. The idea is to reward them or to at least highlight the effort at the fundraising dinner in the afternoon. In parallel, which could be of great interest to you guys, is this master class on comprehensive insulin management for frontline healthcare workers. We all know that when it comes to diabetes, especially type 2 diabetes, insulin management is quite complex. At school, we don't dedicate a lot of time to be taught that specific skills. So some of the healthcare providers, from previous studies that we conducted, even in Swane, some of the healthcare providers unfortunately don't have the confidence or the know-how on managing patients on insulin. So we have this master class. I will share briefly the outline of what is supposed to happen during that master class. On the same afternoon, we also have a session, for example, delivering diabetes care in underserved area. It has been always our desire as the Diabetes Alliance to understand also the experience of people who are not in Gauteng or in Western Cape or in KwaZulu-Natal. We know the country is big. You have Eastern Cape, you have Northern Cape, you have Mpumalanga. How are those people accessing care, and what are the challenges in those areas, so that obviously we can tailor our advocacy messages. So we have this big workshop where you have organization partners like the Rural Doctor Association, you have the Academy of Science of South Africa, you have Doctor Without Borders coming all the way from the Eastern Cape, where they are running a diabetes NCD program. So that will be interesting to see really what comes out of that workshop. Another partner, FIND, will be running a workshop on access to continuous glucose monitoring. These are one of the revolutions in the space of diabetes that allows especially those who are injecting insulin not to have to finger prick 5 or 4 or 6 times a day. With CGM, they can have the result, and they can have that really comfortable, really without the trauma of finger pricking so many times a day. You can imagine also for the kids and the younger people. So here the question is really in terms of access. We've seen some progress in the country, but the majority still are not able to afford this product. It's something that you usually have it patched on your shoulder for 2 weeks. I think it costs about 700 or so, depending on the one you use. So you can imagine it's not a lot of people who can afford such a thing. So the conversation here should probably is around how do we increase access in the country for CGMs. On the last day, we continue with the thematic session that I described already earlier. Here we will focus on management and access to care, on surveillance, trying to solve the challenge of data when it comes to diabetes. Here I can share an anecdote. You guys might know that we usually quote the International Diabetes Federation in terms of estimate from South Africa. And in 2021, the IDF told us that there is an estimate 4.3 million South Africans or people in South Africa living with diabetes. Fast forward to 2025, the latest atlas came out in January, February. It says it's 2.1 million. So the question is, what has happened to almost 2 million of the South Africans that were said previously to be living with diabetes? Was it an overestimation, or are we now underestimating? Unfortunately, the Department of Health and the minister cannot tell you whether we are underestimating or overestimating. So we are obviously risking here to have people falling under the cracks and people left behind. So it's important that we address this challenge of surveillance and data systems when it comes to diabetes, and probably to most NCDs in the country. Then we have a session focusing on innovation and research, obviously trying to promote the locally driven research in South Africa that can really change the game moving forward. We have people, for example, with expertise in AI from Department of Engineering that will be talking, Professor Wande, and there are others who will be bringing their perspective in terms of groundbreaking research that they are leading to change the game in diabetes. In the afternoon, we have a big debate. This is a specific high-level panel discussion, roundtable discussion that I'm leading as the chairperson of the Diabetes Alliance, and I will have around the table really senior people from various angles in society to answer the question, what then do we do after hearing about the great innovations, after positioning diabetes as the #1 cause of death in the country? What are the concrete commitments that we can take living out of the summit? So that is really something exciting to look forward to. Again, in parallel, we have a full day training for healthcare providers. In the morning, we have a master class on psychosocial and mental health support in diabetes. For those who have listened to me previously on this platform, I've really tried to raise awareness in terms of the connection with diabetes and mental health, and how it's such a neglected and such an overlooked aspect of diabetes care. So what we've done here, we are working with a clinical psychologist to tailor a specific masterclass that will equip healthcare providers in terms of addressing this challenge in the clinic, in the consulting room. So this is really never seen before. I don't think you will access such a panel, such a training anywhere else in the country. So it's really something that we want to pioneer, and we want to see how we can even take it further beyond the summit. In the afternoon, we're working with the Podiatry Association. Our podiatrists are putting together a master class on foot health in diabetes. You imagine, and you know probably from experience, that amputation and foot complications are the #1 complication of diabetes in our settings. So it's important that we ensure that our healthcare providers are very clued up when it comes to this aspect of care. We still see a lot of patients living with diabetes who unfortunately don't benefit from a foot exam in the clinic. So this is another opportunity to call on us as healthcare providers to really ask the patient to remove their shoes at least once a year, so that you can satisfy yourself that there is nothing that you are missing, so that we can reduce the high numbers of amputation that we're seeing. And the last year is just some of the speakers that I mentioned briefly. Some of the people here, their names have been replaced, but you can see already it's really broad. You have clinicians, you have podiatrists, you have researchers, you have people from the private sector, and so on. We are busy updating this agenda with the full and final list of speakers. I didn't mention that we have 19 CPD points available throughout the summit for participants, 19 CPD points. So that is also an innovation for the Diabetes Summit. It's the first time that we've made CPD point available. Quickly then, before opening to question, I just want to show you briefly what some of those workshops are looking like. Here you have the full day diabetes management workshop that I mentioned on the 11th of November as again, full day. So I'm just gonna quickly show you what you to expect on that day. So we will have the normal opening. You have 7 modules throughout the day, from first starting with the landscape of diabetes in South Africa. You have Dr. Joseph Kibakio Mwangi, who is from the WHO, who will be taking the colleagues in terms of epidemiology of diabetes. And then we start the clinical foundation with Dr. Nkachwa from Sefako Makato, who will be talking about that. Then we have an expert coach and diabetes nurse educator, Hazana Ali, who will take the colleagues for 60 minutes in terms of lifestyle and coaching. We know that people living with diabetes should implement lifestyle modification, but are we equipped in terms of accompanying them? So that's why now we will talk about coaching. It's not about just giving instruction or telling the patient what to do, but it's in terms of motivational interviewing. How do we take the patient in that journey of changing step by step? So you can imagine the value of such a module. Then Dr. Nkachwa is coming back in talking about medication in diabetes, your oral drugs, and the various options available and how to titrate. And then we have Dr. J, who is, I think, is an endocrinologist, who will be giving a 60-minute insulin management course. Obviously, for those who might not plan of attending the full master class, at least here they can talk about the initiation and titration of insulin in mostly type 2 diabetes. We have a specific 1-hour module in terms of complication prevention and screening. You can imagine a big part of diabetes management is really in terms of preventing complication and screening and ensuring that when we see anything, we can intervene. Here, what we've done, we have really brought a number of experts, from oral health expert to podiatrist to Dr. Tabiso is a high care expert, and Mr. Andrew is a biokinetics, who will then come and take the colleagues through those stations in terms of preventing and ensuring that our people living with diabetes are not just living, but they are living fully and they are living healthy. In the afternoon, we have 45 minutes here with Jack Pretorius. He is a psychologist. He will take us through mental health and psychosocial barriers in diabetes. So you can see some of those modules that we are bringing are really not those that you will expect usually, but they are critical. This is really from experience. We're working with clinical care platform, identifying the real gaps, so that one who can attend this can be sure that he really will be ready to go back and to satisfy the needs of the patient. The last one that I want to zoom into is this one, the insulin master class, the insulin management master class. We have Dr. Claudine Lee, she's a GP, Dr. Christel, she's also a GP, as well as Dr. Bruno Poli. Some people might know Dr. Poli. He's been working in Soweto for many, many years now, and he will be in this panel. So basically, it's about setting the scene, what is available in terms of insulin in the country. We want to put the people living with diabetes as the center. So what we will do here is have a person with diabetes, sharing their experience when it came to their own transition journey from oral to insulin. And then after that, Dr. Christel will talk about the insulin conversation, which is a critical steps in ensuring that our patients are not rejecting. I'm sure a lot of you have many stories about patients who are rejecting and refusing insulin. So how do you have the insulin conversation? When should you have it? How do you make sure that you overcome clinical inertia when it comes to insulin? Then you will obviously have to, we will learn about starting insulin, what are the guidelines, the decision points, and Dr. Bruno will bring in the topic on human versus analogs. You know, in the public sector, there are more analogs coming now because obviously of the discontinuation of mostly the human insulin pens So now the companies that are on tender or that are providing product to the government are bringing analogs. So we want to make sure that our colleagues, the healthcare providers, are aware of what's going on and are familiar and are starting to get comfortable in manipulating those new products. And obviously, in closing there will be some interactive case discussions. So yeah, that's in those that I can zoom in. But as I said, is a total of 4 to recap. The first day on the 11th, full day diabetes management workshop. The second day in the afternoon, you have a master class on insulin management. And the last day, full day in the morning, the master class on mental health and psychosocial support. And in the afternoon, the master class on food care. So that's really what to expect at the Diabetes Summit. And yeah, we are very excited. You can imagine a lot of work has been put into this. You can see so many people are involved and are bringing their expertise to the benefit of the hopefully as many people as we can fill in those rooms. And yeah, I'm happy to answer any question that you may have. We have a website where you can get a bit more information. You just type Diabetes Alliance and you will find the website.
Awesome, brother Patrick. Yeah, this is an awesome one. I'm actually trying to get that link so that I can share with the colleagues. But there were a number of obvious questions, so I'm gonna ask you direct questions so that colleagues can have clarity. Please confirm the date for the summit.
11 to 13 November in about
So
10 days from
11
now.
to 13 November, tick. Remind us of the venue.
It's at the Hudson OR Tambo, 5 minutes or so away from the airport. So don't go to the airport. You should trust your GPS.
All right. So it's Radisson Hotel at the OR Tambo there.
Yeah, it's called Hudson Hotel and Convention Center OR Tambo. They've actually named it after OR Tambo.
Yes. And then so we know where, we know when, the duration, and then we start 8 o'clock, right? On the 11th.
Yes, registration on the 11th at 8.
Awesome.
And I think Dr. Mawela will be starting at 9:30 or 9 on that day.
Yes. And then, colleagues, I'm sharing the website link for the Diabetes Alliance. On that page, if you scroll down, you should see. Actually, let me see if I can do the magic for you. Let me share. Can I share, Patrick? I want to show them the website.
Okay, let me stop.
Yeah. Can you guys see the? Let me also help you because we are streaming this on LinkedIn, Patrick. So after here, you must go there and just like and share. So colleagues who are joining us there on the socials, I hope you can see this. So this is the Diabetes Summit Alliance page. If you scroll downwards, you'll see all the information that you can see. We are expecting over 300 delegates, and we have already counted you in that number. So please don't disappoint us. We want to see you there. And then if you want to register, you'll click on register now. And someone said it's for big people. Yeah, I mean, it's good to go there and meet big people, but we have clinical, we do have clinical sessions, especially the pre-summit on the 11th. It's a pure clinical one, end to end. But every single day, as per what Dr. Patrick has been showing us, you'll see on the program there at the bottom, there's something, there's insulin masterclass, there's podiatry, there's I'll ask Dr. Patrick, because when health workers see those speeches, they think, it's a meeting for big people. But there are implications, colleagues, if we don't participate at this, what we call big meetings. Those big people are going to decide for me and you if we don't participate. So,
Mhm.
so you must make an effort, right? And I see, hey, Dr. Mpo,
Mhm.
hi, nice, 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 nice. Mayas is asking, will the summit talk about insulin in pregnancy? Whoo. Not
I
not
think it
in
can be a
detail.
topic. Yeah, it can be a topic to be debated during the master class there. If you
Yes.
have a question, obviously the experts will be
Yes.
there. You can engage with them,
Yes.
and
Yes.
then they can direct. One thing also that we want to do, obviously, Dr. Mawela, we discussed this. We are doing this for the first time, and we're
Yeah.
gonna collect feedback from the colleague. If
Mm,
it's something that people are interested in, we will see
mm,
how we package it to have it on a regular basis as a platform. We are considering, I'm giving some heads up to the colleague. The
mm,
Diabetes Alliance, we've described it already. What we are thinking about is having a professional platform within the Diabetes Alliance where doctors and nurses and allied workers and whoever can now become a full member and benefit for some CPD opportunities. This is done in other countries. You have it in Diabetes UK, Diabetes Australia, and the like. Here in South Africa, the CDE was doing a lot of that in the past, but some of you might know that the CDE is now in a challenging situation and there is a gap that has been created. So people have approached us as a Diabetes Alliance and we are thinking about creating that professional platform where the colleagues can now get some upskilling in terms of diabetes. So we are testing it with CCP because of obviously their position in this, and we can take it further if it is something that the colleagues are really enjoying. Doctor, I'm not hearing you. I don't know, you're on mute or something.
Ooh, I'm muted again. Yeah, because I had background noise. My daughter was screaming. I see on the
Mm.
chat there is Faith. Faith says, actually, let me put it. I forgot that I can actually show everyone the comments. Faith says, hi, doctor. Thank you. Can I request funding? I'm interested to attend. I'm a diabetes nurse. So I'm going to say
Mm.
two things. You know, to show value in yourself, you must invest in yourself. So, Faith, plan to join. You know, find some savings somewhere and join. But I do have something for you. But I want to make sure that even if you don't get what I'm about to say, Faith, please, because you're a diabetes nurse, we want to see you there at the summit, and not only in the clinical talks. You must join the policy things because you don't want you're not sure who's going to represent you there, you know. So you want to make sure that your voice is heard. If you are representing your patients that you treat every day, I'm sure you know the challenges they have, and I would really I'm wanting you to be there in person. Now, here is the thing. Are you ready, Faith? If you visit, so there are 5 people who are going to get sponsorship. Who are these people? There's 3 things you have to do. You have to go to CCP's LinkedIn page. You're gonna find this session. It's there. It's running live now. You have to like it. Like, you click there to say like, give it an emoji. You have to comment and say, wow, I'm looking forward to the summit. Number 3, you must in LinkedIn. We don't say repost. We say, is it re what? Re what what?
Repost, reshare, whatever.
Reshare, repost. Faith, please say yes. Please say yes there, Faith. See, please say yes that you got it. Let me write it. You must like, you must comment, and you must share, or as we call it,
Mhm.
repost.
Mhm.
Patrick, LinkedIn is your platform. You must you must teach me.
You were
So
saying something important there, Dr. Mawela. The diabetes nurse educator are not a recognized profession by the Department of Health.
yeah.
So already there you see a clear advocacy and policy issue. So why is it that in all our facilities we don't have diabetes nurse educator? And I'm sure Faith knows this. A lot of them work in the private, but in the public you don't see them unless maybe it's at a tertiary institution. So already there is a panel discussion on education. It's important that Faith attend so that she can raise that to the people there to say, what do we need to see, to do, so that people, nurse educators can be recognized and they can support the patient even in the public facilities.
Yeah, so I've put the link there. If you check the post I've just posted, it says there are 5 sponsorships and we will announce them by the end of this week. So it means by Friday we are going to announce the 5 people. But you must don't take the sponsorship if you're not going to attend. Colleagues, it's very important because there are people who might want to attend. So when we list your name and you feel like you won't attend, just let us know so that we can try the next person. But there's 5 sponsorships that are available, right? What you need to do is to like this event, this information session. It's live there as I speak to you. I checked it. I actually tagged Dr. Patrick and Diabetic Alliance. So you must click like, you must comment and say, wow, Dr. Patrick, what an awesome information session or initiative, or we love your advocacy for diabetes. Then you must share it on your status. You share this whole thing, recording this one, just say reshare on your personal page. And then we have 5. Hanan, you want to donate more? Okay, 3 or 5 donate. There are 5 seats available. But if you want to sponsor, if you can attend and you want to sponsor, please let us know. Then we can select more people to go and learn. Diabetes is a big problem. Tandegile is asking, are online platforms going to be available if I can attend? It's for day 1. There is day 1 only. We want you to attend the 3 days, But the day 1 is what we have committed. Do send us emails if you feel like you want us to stream all the days. It's a huge task for CCP. But what we can promise for now is that we will share the link for those of you who want to attend the full day clinical workshop. So CCP will be there with our videographers and stuff, and then we will stream that session live. So I hope we are good on that one. Right. Awesome. Let me see if we have any questions, because most of the questions were about when and where. Funding we have addressed. Mpo is very happy with you, Dr. Patrick, for this program. Yeah. So we are happy. All right. I hope I didn't miss any of your questions, colleagues. Otherwise, you can retype it. What I have for you, Patrick, just for 5 minutes, just to engage you on this. So this summit, when it ends, and you say, wow, this was successful, what would have happened? How would you how are you going to define success and say, yes, we did it?
Yeah, because of as we saw on the program, first will be obviously attendance.
Yeah.
If our healthcare providers have attended the sessions, obviously we'll be happy. Yeah. On the other side, if the other events have been all, anyway, full home is always a good thing. I can say that we've had a number of sponsors. Those who will come will see the exhibition. Again, there's been so many firsts. Exhibition also was a first this year. You'll see when you attend there. Another thing is not right at the end, but it's what can we do beyond the conversation. We are always trying to make sure that there's an output that can carry in terms of advocacy. In 2023, it was a report. This time around, we have approached, some colleague might know, the journal of that is edited by Professor Bob Match. I think it's the African Family Medicine Public Health What Journal. We are considering publishing some of the output of the conference in that journal, but obviously we hope to raise awareness around diabetes. We hope to stimulate new conversations around the various partners that will be there. For example, if you are a researcher, it could trigger some research questions. If you are a clinician, You will understand better your patients because you will have the opportunity to engage with them there. You can improve your clinical practice. So there's really a lot of wins. The big one is at the country level is raising awareness and hopefully getting the Department of Health to make a step further in the response on diabetes. Doc, you are mute again.
It's because I have background noise. I keep on muting there. I also saw, okay, the clinical things make me very excited, public health, but I saw mental health and the psychosocial aspects. Why is that important, Patrick? Why was it there in your previous summit?
No, that's the very first time
Yeah.
we're having that. I'm actually coming from the mental health conference where we also spoke about the connection mental health and diabetes. To make a long story short, people living with diabetes are 2 to 3 times at higher risk to develop depressions. They can develop anxiety, burnout, disease, eating disorders, and stuff like that. The problem is if those mental health challenges are not addressed, it will be very difficult to achieve glycemic control because some of them checked out completely from the treatment. They might sit in front of you and tell you that, yes, I inject, or yes, I do this and that. But believe you me, maybe they have stopped it 3 months ago already. So if we are, as professionals, not aware of those things, we don't ask the question, how are you coping? How are you doing? Let's move away from focusing on glucose levels and look at the whole person. Do you have any challenge in your life? Remember, you are talking about a husband. You are talking about maybe a wife. You are talking about it's people who have full lives behind that they are already struggling with. And diabetes is just on top of that. The burden additional. So let's see how we can help them in order to achieve better control. So that's the connection, and it's very critical that as professionals we understand it and we equip ourselves to respond to those challenges.
Awesome, 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 Patrick. Look at my hand. There's a saying. There's a saying. It says, if you have Everest dreams, Mount Everest dreams, you need Everest team. And there's another one says, no one man can do anything of significance alone. And I see you bringing organizations, partnerships, and why is that important in responding to diabetes, particularly? Why is it important to make it everybody's business?
No, thank you, Doc. You already said, for example, in Africa, we say if you want to go far, if you want to go fast, go alone. If you want to go far, go with people.
Yeah.
So we have already all those saying. But now, when it comes to diabetes, the complexity of the condition itself is there's something that we call a whole of society approach, whereby all of us have a role to play if we want to address this. Not only it cannot only be the Department of Health and the doctor and the nurses. No, all of us. You can see the mental health aspect is there, the food and nutrition is there, the complication aspect. So all those players in society can contribute to us having a more effective response to diabetes in the country. So that's really what we want to achieve. The Department of Health in the NSP, the strategic plan, talk about the whole of society approach. But sometimes, as you know, when the Department of Health is convening, they are the one calling. People tend to feel like it's a top-down approach. So here we have a civil society organization setting the table and calling on people who comes with different approach. They are more relaxed, they feel more welcomed, and obviously more open to contribute. So that's why we felt it was important, or we believe the Diabetes Alliance has a role to play in terms of convening such a platform with all the critical players in society so that we can really find the solution of diabetes, which is the #1 killer in South Africa. Your mic, Doc, your mic.
Yeah, thanks for that. I see people are complaining about my link. I want to try and go to LinkedIn and see if I can copy the correct link. They say it takes them to my personal page, but it's written clinical care platform, that LinkedIn link. But anyway, if you're on LinkedIn, on search, just say clinical care platform. When it shows up, you're going to see this event as we speak. But I thought maybe I got it all wrong, but I see it says LinkedIn/ clinical care platform. So, yeah, okay. Patrick, then the last one. There's so many firsts in your summit this time, including that pre-summit event for health workers. You also said it's the first time you do CPD points. Today you are engaging health workers, and looking at the comments, people are really interested to attend or even to support your work, etc. You know, we are talking healthcare. Most of us, yes, it's a profession, but it's a profession that requires a calling. You know, I know there's many professions out there. You could be a supermarket manager, but this particular profession is not for everyone. You know, regardless of how you got here, colleagues. I know some of us, we just got a bursary, we were at home, we ended up here. But I tell you, it doesn't happen by chance. If you work in healthcare, it's a very meaningful, purposeful profession. You know, can you close as a part of your closing remarks, encouraging health workers, because it's very difficult to be a health worker today. We are unemployed. There's a lot of things that are happening. Just encourage us, and then also closing with why I must be there. Why I need to, you have a seat for me. I know you have a seat for me as a nurse, you have a seat for me as a clinical associate, as a podiatrist, physio. Colleagues, I can't list all the professions, but there's a seat for you at the summit. And Dr. Patrick is going to do a closing remarks, encouraging us firstly to feel good about our career choice, because it's not just a career, it's a calling, but to say there's a seat for you in November.
No, thank you, Doc. One of the first, again, we have a fundraising dinner
Oh,
on the 12th. That's another first. Diabetes is a big crisis. I'm sure you guys in the clinics, almost 50% or maybe more of your chronic patients are now people living with diabetes. We cannot keep ignoring this situation because it's going to get worse. It's important, each of us in our own space. Personally, I can have told my story about how I found myself in this space, but as Dr. Mawela said, and I believe nothing is by chance. Each of us has a role to play. What motivates me, and that's what I want to transmit, is the person living with diabetes. We need to have more compassion. We need to have more understanding of what those people are going through. And yes, ourselves, we might not be excused, or we might not, we might find ourselves in the seat of the person living with diabetes. So with this diabetes summit, we are really giving a voice to everybody. So please come and make your voice count. And as Dr. Mawela says, come also and speak for your patient. If you're in a public sector clinic, come and speak for your patient. Tell them, why is it that the care is not good? Why is it that you need? What is the gaps, and so on and so forth. So come for yourself to benefit from the training, but also to give a voice to those who will be sitting at home. Maybe they've been amputated, maybe they are going through kidney failures, maybe what other situation they can get through. You have the opportunity to be there and confront the power that be, and share what is your experience on the ground in order to make a difference in tomorrow.
Awesome. Thank you, Dr. Patrick Ngasa Piote. Colleagues, we can't say anything more except to make sure that your take-home message is clear. Number one, love your profession. Number two, love your patients. Number three, you need to grow yourself so that you can care for your patients better. The summit, it is that opportunity, particularly in the world of diabetes. We know the stats. and we think it's an underrepresentation of the real issue. It is probably way bigger because most of us have it, we don't even know. You know, so very, very important. From an action point of view, we have a sponsorship for 5 people. All you need to do is to go to our LinkedIn page, the Clinical Care Platform. You need to find this live event. It will be a recording. Please like it, make a comment, then share it on your status. And then we're going to randomly just select 5 people who have done that. And then we will announce them on Friday. And hopefully it is you. But even if you don't get the sponsorship, right? As part of your self-image, if you believe that you are a valuable person, you know that you have to continue to add value to yourself. So this is very, very, very important. So I did share the link for the Diabetes Summit so that you can register for the full program. If you think you are not going to be in Gauteng, we are only going to stream day 1 because we really want to encourage in-person conversations about diabetes. If we stream the whole thing, then you know you guys are not going to be there. You'll be in your clinic putting the earpiece there working, which is good, serving our people. But we must always find time to pause, you know, and grow ourselves to be better people. From a clinical care platform point of view, we are a collaborator for the pre-summit clinical workshop, the full day on the 11th. We will stream that live and we will send an emailer tomorrow around 11. Expect it. We will tell you what is it that you can do just for that one day. But I really want to encourage you, if you are, especially if you are around Gauteng, I man, take time off and just call it self-care day. and care for yourself, you know. Abatle says this is great presentation. We'll watch it over. You see, it means what you are going to get at the summit. I don't want to say it's so important. Thanks, Hanan. I'm so happy that you guys are so excited. Amatle is so happy. Brenda is so happy. Let me see this one so that I can see. This program looks amazing, but being during the week, it's not easy. It's gonna be nice if we also had a virtual conference and we pay for attendance. Okay, I'll talk to yeah, let's start first by getting there, and then we will see if we can make the full. It's gonna be a huge task to do that. I think we will see. But for now, what is confirmed is that Anonymous day 1 is going to be there in full swing. It's only yeah. Let's grow Diabetes Alliance through collaboration. I will review your feedback. You know, I always try to be responsive to your needs. So yeah, let me try and see what is it that we can do. Puleng sees value there, even in occupational medicine. Yes. By the way, there's going to be a commitment by the workplaces on how diabetes should be managed in those spaces. And also we appreciate the advice there. Nomondo says, please engage the media and nurses, mental health. Yeah, that's what we are really trying to do. All right, colleagues, that's it for tonight. This was supposed to be 30 minutes, but you can see that you kept us here. So let's then connect. I think, Patrick, we must have a follow-up information session in November, you know, for 30 minutes, just to say, hey, this is happening. This is real. And then we take it from there. Thank you for making time, Brother Ngasa, to be here. Colleagues, may I ask you to have a restful night with your families. Tomorrow we have a very important webinar, pregnancy and the kidneys. Pregnancy and the kidneys. What eats away the kidneys? Hypertension, diabetes. So it's still diabetes, even if we are talking at that level. Night, colleagues. Bye. Thanks, Brother Patrick.
Welcome to the 2025 Diabetes Summit Information Session, hosted by the Diabetes Alliance in collaboration with the University of Pretoria and the World Health Organization South Africa, and supported by the National Department of Health. Building on the success of the landmark 2023 Diabetes Summit, which united over 500 participants and produced the influential Diabetes Summit report, this year takes the next step, turning discussion into action. This year's summit focuses on 5 strategic areas: awareness and prevention, education, management and access to care, surveillance, and innovation and research. Our audience brings together policymakers, healthcare providers, people living with diabetes, advocates, and innovators, all united by one mission: driving measurable progress in diabetes prevention and care. Thank you for being part of the movement toward a healthier South Africa. Let's get started.